Mhm. Well, hello and welcome to Badger Talks Live Quick Picks, which brings exciting happenings, resources, and talent from your UW flagship campus to the people of Wisconsin and beyond. I'm Zulmari Silva Pedraza, originally from San Lorenzo, Puerto Rico. I'm a fifth-year PhD student in the Material Science and Engineering department, and currently I am researching piezoelectric polymers for biomedical applications. I have become involved in studying cardiovascular diseases at the Wisconsin Institute for Medical Research, guided by Dr. Bo Liu. I'm pleased to introduce Professor Liu and surgery resident Jack Bontekoe of the Division of Vascular Surgery. Today, Bo and Jack will discuss how cardiovascular disease is the leading cause of death in Wisconsin. Here at UW Health and the University of Wisconsin-Madison, physicians and scientists work together to deliver world-class care and discover novel treatments for those suffering with cardiovascular diseases. Their team of experts in vascular surgery and biology are interested in abdominal aortic aneurysms, a disease where the largest blood vessel in the body, known as the aorta, weakens and becomes enlarged, which can be life-threatening if untreated. Dr. Bo Liu is a professor of cell biology. Being a vascular patient herself, she devotes her life to study blood vessels and search for new drugs and devices to treat vascular diseases. Dr. Jack Bontekoe is an integrated vascular surgery resident at UW Health and a current research fellow in Dr. Liu's lab. After his training, Jack looks forward to a career in academic surgery and incorporating his research into his care for his patients. Please welcome Bo Liu and Jack Bontekoe.
Thank you, Sumeri, for that nice introduction. And good morning, dear Badger Talk viewers. Jack and I are honored to be here and talk about cardiovascular disease, commonly known as heart disease, the number one cause of death in our state and in our country. You are likely familiar with some of the risk factors for heart disease, such as high blood pressure, high cholesterol, and smoking. These conditions can be managed with the right medication and lifestyle changes. However, you may not know that cardiovascular disease involves the heart and blood vessels, typically caused by a process called atherosclerosis. In atherosclerosis, plaque builds up within the blood vessel wall, causing inflammation. When a plaque becomes so big and unstable, it can block blood flow and cause damages to the downstream organs. This is what happens during a heart attack and stroke. While atherosclerosis is very common, there is still much to learn about this disease and other vascular conditions. This morning, Jack and I will talk about a lesser-known disease called abdominal aortic aneurysm, which I'll have Jack describe.
Thanks, Bo. The aorta is the largest blood vessel in the body and acts as a high-pressure pipe that delivers all of the blood that's ejected out of the heart and delivers it to the rest of the body. In some people, the wall of the aorta weakens over time, causing it to progressively balloon outward and enlarge in size. This dilated aorta is what we call an aortic aneurysm. Aneurysms can occur anywhere along the aorta, but most commonly occur in the abdominal aorta, which is the lowest section that gives blood to the abdominal and pelvic organs and then down into the legs. Today, during this talk, we'll be focusing on the abdominal aortic aneurysms, which we'll now be referring to as AAA. AAAs are a relatively common condition in patients over the age of 65. They're strongly associated with smoking, and the longer duration someone has smoked increases their chance of developing a AAA. They're also more likely to occur in men, Caucasians, those with atherosclerotic disease, and hypertension. Having a family member with a AAA can also increase your risk. Most of the time, AAAs are asymptomatic and found incidentally, meaning that they don't cause symptoms, and most people find out they have a AAA when being evaluated for another problem. However, aneurysms can be deadly if they go untreated. AAAs continue to expand outward over time and eventually can reach a point where the aortic wall suddenly ruptures, causing internal bleeding. Without emergency surgery, a ruptured aneurysm is lethal, and even if performed in time, surgery in this instance is very high risk. Signs of a ruptured AAA or an aneurysm that's about to rupture can include new severe back pain or abdominal pain. We define an aneurysm when a blood vessel dilates more than 50% of its normal width. In men, this occurs when the abdominal aorta measures about 3 centimeters in diameter, and women about 2.5 centimeters. At this size, the chances of an aneurysm rupture are still very low. But as the aneurysm grows, its chances of rupture increase. Large population studies have allowed us to develop size guidelines to when an aneurysm should be fixed. In men, an aneurysm should be repaired when its diameter is 5.5 centimeters or greater, and in women at 5 centimeters or greater. As mentioned earlier, most AAAs are found incidentally when being evaluated for another condition. However, we do recommend AAA screening for some people. According to practice guidelines by the Society for Vascular Surgery, anyone over the age of 65 who has a history of tobacco use should undergo a one-time ultrasound screening for AAA. Additionally, anyone with a first-degree relative who has had a AAA should also be screened once they reach 65. Ultrasounds are incredibly accurate at detecting AAAs. They're also widely available and also low cost to get done. Once diagnosed with a AAA, patients should be referred to a vascular surgeon and undergo surveillance imaging with an ultrasound or CAT scan, depending on how large the aneurysm is, until the time of their repair. There are no treatments for AAA other than surgery. Doctors and surgeons will recommend that patients, once diagnosed, will or should stop smoking to try and better control their blood pressure. However, there are no medications to prevent AAA or stop them from growing or rupturing. Aneurysms are fixed in 2 different types of surgery. The first is with open surgery, where an incision is made in the abdomen and the aneurysm is opened and a tube graft is sewn in to replace the damaged aneurysmal aorta. The other is with what we call endovascular surgery, or repair from the inside of the aorta. This is commonly done by puncturing an artery in the groin, then inserting wires and catheters that allow us to deliver what we call a stent graft. This graft lines the inside of the aorta so that blood flows through the graft and relieves the pressure off of the aneurysm wall, preventing it from rupture. There are also many reasons why a vascular surgeon may recommend one type of surgery over the other, which depends on a conversation with the patient. UW-Madison is a leading institution in complex aortic aneurysm disease and is one of the highest volume centers for aneurysm repair in the country. Now I'll have Bo talk a little bit more about our research within our lab.
As Jack mentioned before, there are no treatments for AAA other than surgery. My hope is that our team of experts from vascular biology, vascular surgery, chemists, and engineering will help to find new medical therapies for aneurysm patients. While this disease is incredibly complex, our lab, in the past few years, have made some major discoveries about its pathology and potential treatment strategy. The aortic wall is made of 3 layers of cells. The middle layer is the largest layer and made of smooth muscle cells. we found that during aneurysm, smooth muscle cells die from a special kind of a cell death. We call it necroptosis, which cause high amounts of inflammation and damage the aortic wall. After screening thousands of potential drug candidates, we identified a chemical or inhibitor capable of blocking this special kind of cell death. And we tested this drug in a mouse model that simulates human AAA. The mice treated with the inhibitor were protected from developing an AAA because their smooth muscle cells are protected or not damaged. In another project, which Jack has been working very hard on, we look at aneurysm rupture, the major cause of death in aneurysm patients. We would like to understand what are the microscopic changes that may cause an aneurysm to rupture. We are very fortunate to be here at the UW-Madison, one of the top medical centers for aortic surgery, and we work closely with the vascular surgeons. We analyze specimens of aortic tissue that Jack collected from ruptured aneurysm and intact aneurysm during open surgery. And we have produced an aneurysm rupture mouse model. With novel technology, we are able to study the molecules within each cell in the aortic wall tissue and even predict how they behave or become dysfunctional and cause aneurysm rupture. We believe these discoveries will help us to find a new drug which could help slow aneurysm growth and reduce the chance of rupture. Such a drug would be very, very useful, especially to our rural Wisconsin patients with an aneurysm, to help protect them between the time they are diagnosed and finding a highly skilled vascular surgeon for repair. With that, we thank our viewers for your attention and the Badger Talk organizers. Jack, anything to add?
Thanks, Bo. We hope that this talk was helpful in emphasizing how important screening of at-risk patients is for this silent but potentially deadly disease, and also to show the need for multidisciplinary research teams to discover treatments for patients with AAA. But we truly want to emphasize our thanks to our patients for their contributions for making our research possible. If you have any clinical questions about aneurysms or have any other vascular disease concerns, we encourage you to contact our vascular surgery clinic, where we'd be happy to help connect you with a vascular surgeon. And for any other questions regarding research or interest in collaborations, please feel free to reach out to Bo or myself. Well, that concludes today's presentation. Thank you for tuning in, and feel free to post any questions in the chat, and I'll be happy to answer them after the live stream. Thanks.
Thank you.
Thank you for watching this Badger Talks live event produced by the University of Wisconsin-Madison through UW Connect's outreach and the Office of State Relations. Follow us on Facebook and YouTube to see the library of past recorded talks. Please visit badgertalks.wisc.edu to see the schedule of upcoming talks, sign up for the Badger Talks email list, and search the roster of over 400 UW experts who are available to give talks on important issues in your Wisconsin community.